Hello, my name is Avery Orton, and my objective today is to protect patients by protecting our nurses. Imagine yourself as a nurse working a 12-hour shift, juggling 5 to 6 patients, managing emergencies, charting endlessly, administering medication, comforting distressed families, when suddenly a patient becomes verbally abusive, or possibly worse, physically aggressive. You report it, but nothing seems to happen. You're just exhausted. You're burned out by the repetitive, physically and emotionally exhausting shifts, and you think to yourself, how long can I keep doing this? Sadly, this isn't that rare. Nurses face unsafe staffing, burnout, and workplace violence daily. I'm here to argue that solving the nursing shortage requires strong policies like safe staffing ratios, limits on mandatory overtime, and workplace violence prevention programs. Without them, both nurses and patients will suffer. So here's the problem and why it matters. Research shows that nurses working more than 40 hours weekly face much higher odds of burnout and leaving their jobs. This compounds with the workplace violence problem. Violence on the job worsens stress and depression and increases the likelihood of nurses quitting. Understaffing itself raises the risk of aggression. And the result? Burnout and turnover feed the staffing shortage, while patients face more errors, longer waits, and poorer outcomes. There are different opinions and counter-arguments. Some hospital leaders push back as they worry that mandated staffing ratios are too costly, especially for smaller facilities, or argue that there aren't enough nurses to meet the demand. Others believe violence is inevitable in healthcare, so prevention programs create more paperwork without any real results. Finally, some suggest that focusing on wellness workshops instead of regulations, claiming that burnout can be solved individually rather than structurally. I believe that while wellness programs have value, without structural protections, they're just band-aids on a bigger problem. Real solutions include, in my opinion, safe staffing ratios with funding support for under-resourced hospitals like smaller and rural areas, limits on mandatory overtime preventing unsafe shift lengths, and comprehensive workplace violence prevention programs, including training, reporting, and accountability. I think that these policies could help protect nurses' mental health, improve retention, and safeguard patient safety. One key audience that may resist this view is hospital administrators and financial officers, especially in those smaller, more rural hospitals that have a tighter budget. They might fear high costs and worry that the stricter regulations will worsen the staffing shortages that already exist. So some strategies to shifting those opinions are finding that common ground where we can emphasize everyone wants a safe, effective, and cost-effective care. Evidence shows that staffing reforms reduce costly turnover, improve quality ratings, and lower liability from violence. Hospitals already spend billions each year managing the consequences of burnout and workplace violence, so preventative policies could save money in the long run. So now's the time for our call to action. To hospital leaders and lawmakers, support the policies that enforce safe staffing, limit mandatory overtime, and require workplace violence prevention programs. To my fellow nurses, continue to advocate through professional organizations, because when nurses are safe and supported, patients are safer too. Protecting nurses means protecting healthcare itself. Thank you.